Now we want to look at some things that are going to affect the rates of tissue repair. So 3 things that we're going to talk about: diet, which is nutrition, what kind of nutrients are you getting; circulation, which is basically saying how well are you delivering these nutrients around the body; and age, how old are you. So you want the right nutrients, so we'll talk about those in a sec. Circulation, you want to increase circulation to increase tissue repair. Why? Because that's, if you have increased circulation, you have increased circulation of clotting proteins and white blood cells and all those things we just talked about. Age, you want to lower age. So the lower your age, the faster the tissue repair. And that's obvious, right? As people get older, they have a hard time recovering from things. So that is circulation and age. Diet, we want to look at a few different vitamins that he talked about. So vitamins are coenzymes. They're not actually enzymes themselves. They just help enzymes function. So let's go through all the different vitamins and see what they help. Vitamin A is good for epithelial tissue. Vitamin B is important for nervous system and the heart. So why is it important for women to take prenatal vitamins? Because not only are they ingesting B vitamins for themselves, but also for this baby's developing nervous system and heart. Vitamin C, I gotta stop. Okay, vitamin C is good for connective tissue and blood vessels. So C for connective tissue and blood vessels. Vitamin D is important with bones. So if you remember those milk commercials, Got Milk or whatever, you'd see fortified with vitamin D or vitamin D added. So vitamin D is important to add to milk because vitamin D also helps with absorption of calcium. Milk has a lot of calcium, and so you want to be able to absorb it. But if you also look at the back of orange juice labels, they typically have a lot of vitamin D added as well. Vitamin E is going to help prevent scarring. So if you just had a surgery or something, you might want to put some vitamin E oil. And vitamin K is important in blood clots. So just because you have those clotting proteins don't mean they can go to work. So vitamin K is important for that process.